abusia for you know kwa baby na near be you can you know you me say ya sound so about back na fe no ye betwa indwumedi so na say the bidi ka catch there no me wo binua eje ya oberima ana say archbishop na kasankasa na no pay no o kan ye ho e wo ye ndwumedi mu enti archbishop so what men kan besa so amwa kwa baby de ba Otaebour Media kasafidi so
Yo KOB miti unkan ye pa mejoso anopay yama happy Sabbath.
Yes, so yama happy day. Na any to say
Nyame adom boko na watwe mu bibia koso boko na esimfu akakra ye nsaka ye ewo ye SD asafunum ye Ghana ni wiase afa na nyina ana ye de ebrewe na unim se asem bi esi wo Kenya na minim se wate ho asem kakra conference ba ko ewo ho ye frɛ won Central Rift Valley Conference. One tina ase no omo se asofo mako dunkron 19 one ntimi ne omo nya adwuma bio.
Adan edi asem na atu mu.
According to conference no omo kire se sa asofo na tekuo bi na one hyehyeye bi ene won dwumadie bi aya wonom ede ba asafo no mu ho no ene asafo no ezi asafo no enhyehyeye emfa nti wonom ayi won. Odwen ho se
any omu enhyehyeye ne mfa de a ene ekwa bia so no mbeyi omu se de said ye nyina ye dum hyehyeye no enti no megidi ye se omu decision no da kwam pepepe
na ebom no na otwe so asofo no so aye press conference abeyi won ho ano se ensema ampanimfo no ka no enye saa na tie na emom ye nhwehwemu bi ya na omu hia ewo conference no mu na mpanimfo amakwan eno ho no mafa so a wonom de ayi won ti migidi se saa nsensem no penchen na ekoso no ye besre na akoma nyina toyem na entiase nso ase aye adwuma yekoso anso ka ye ho se eye kwapra SDA church kwapra eye kronom kwapra SDA church ene na awotwe ya omo 20th anniversary celebration also baso omo de nhyehyeye gu akwam mpanimfo ene asafoma conference no ene titi district no so nyina ka bom Taiwan achi nti ebesre adofo nyina se ene na awotwe danu duru ho a nyina ye motwi na yenko kwapra SD church asafo no ho a mpanimfo te se da asafo ne pokunum islenum no mo maka nyina aye enhyehyeye keobi na yewura yensemunum no na otwi eye otitinani ana president oda West Central African Division what eye pastor professor Basi E.O. Udo na otwi mu one ne mpanimfo nyina kopie mu ewo Ghana eko ensrahwe what one headquarters no ewo Abidjan one botwi free Abidjan eko enkran na eye akwanhwefo asafo no mpanimfo aya wonum wo Ghana no so de ofel so na ehia wonum ne omotwetwe nkomo na omonkomodi twetwe no mu no ana ekopie mu se omopepe kwan ya befa so a asafo no kroye sonko ana kroye mapa mbetimi akan bom na gidie nso anamotuo no etimi akoso yeto aso no nso eye na otwe mu nso no eye conferences ene unions ahodo aya ewo Ghana no bi ekoso to awon session no so na ekopiem ewo eye Ashanti Central Ghana Conference one session echi no onum yi akanifo aya efisa abeyi koi onum bedi eye conference no enim panyina aya omuyi no as president ana asofo omuyi no ye pastor baafo ochiresi abo no omuyi no as president eye Ashanti Central Ghana Conference asem na meken na onum yi pastor David Educhei as executive secretary na onum yi pastor Alexander Opoku enso as treasurer. If you honey bushi so called Southeast Ghana Union Mission so and also and
answer now we call Southeast no kwase bi pastor ochisi abo se mi so a lawyer wana
pastor ochisi abo a lawyer
and as say no wasan so abe president yen say dey enya sem ketu akra
say dey dwumadi na
ayekese e dey trader for Kwame Asisa and afi so no Alex so no Opoku because the Minigana pa no kwa sorry Eugenia so enyano na mede nyame ase pa se unless it abedi sofo na say no conference na hwe ne dwuma pa we die no dia bi dwumadi ka say ahye lessons yaw ana no pay die beda wase pa na answer na obeto aso no say no wo be say isima mienu pe answer na obeto aso na fe we di ensem foforo ana say amana no de ato aso no memu say a quick question unim ye say busumi ewo mu nyina no Black History Month na tuntumfo ebo mu homodin na fe omuji aman si ho tuntumfo mbo mu homodin na fe omuji anima akese bebe akroma se hwe mu kra kire se anima akese a ekoso nyina se tuntumfo na I don't know media but choose media why na otwi anase busumi we say no we didn't see when this work Black History Month ubetimi aka ne ho asem kitu bi e de akire etiefo ni ahwefo a and I don't pay an area with your Sabbath morning show.
Bigidi ye said ya mebo ni deno ye ubia ni padodo na ni mnono machinenka efene Dr. Martin Luther King. Ya ohe ni jumedia ya ubidi eboa ye bibifo tuntumfo wo mayim. Obra na enhyeso kese na ekosoma bibifo wo mayim no eni wiase afana nyina no otijinai ekonkodene ekasai eye no ma bebre se de be ya enhyehye ya ewo ma no ma na enimua atuntumfo no so no ensachrai bebre ebai entimi didi se oye nipa bi nso a ya eye se dan de nyina yekoso ebo na baso ne ye kai no woni nyuma pa obeyeye na yenye edi akire nso ofure nso yesua na yatimi atu anamo a betimi de aboa eye atuntumfo ne adasa nyina nti KOB na eho no Dr. King na ye bo no nyuma pa obeyeye ebo na baso ye pa
Dr. King reso so de winim se minim so bebu sam se so me de ne hwan ye ya de nyina osaje for Dr. Kwame Nkrumah winim se wonu so ebo ne homoden pa wonu ena eje Ghana edisi home na da bia no ya ye nta mo ne din ba memedi bijirama osaje for Dr. Kwame Nkrumah ya ansa na ade wasem twa to okura beba no mamintu bi kana mehwe se Dr. Eda so ewo line so a Dr. Eugenia we will acquire pa in a special with the bar Otaebour Media DOES ya to the Sabbath morning show so nice one every adumoko we him say Black History Month na anye wo mu no binya ende Archbishop say on the Okoma Martin Luther King and I'm also makwama osaje for Dr. Kwame Nkrumah also so no ochefa ne hwan
anka miso na anka meje Martin Luther King na
and you were two chorus Archbishop are two chorus
yeah no eboa na Harriet Tubman so no oboa slaves no my freedom so it's through them na and I so ye ha enti ye do mo asipa for adwuma pa mo edi kan amaye
abusiafo meda abidjafo nyina se yaw fa ensema etwa to fa my quick na afi no
yo ye bre ni nti no
ensum emaye
de di twato no ye nyina ye nim ye wura baafo chi mensa ya wabo nyum bebre afafefo num ne nyum baako amanfo bebre be kai eye Noah one SDA Victory Voices na otwi mu nso no wode na power foforo kra ya watwa wato ne din donkome wode betu dwa eye launching ewo Kumachise Cultural Center na nipa bebre ene anyomtofo atitu so ekopie ho ti ne ye kaadofo ne obia se ne nyom no ade a abom no so wode yie pa ye nyina yenkope bi na yentie na enyansa kiraye ewo ya brabom na yenfa bi nso entu afoforo efo ti yakoso abo yewura bafo chi mensa na baso ye hyenu nkran ewo ne dwumadi ya ode yo abusuafo yakoso frame Archbishop na me ya aduma ye besen ahia bio na otwe se na ya de nsempa no asan abremo we ye Sabbath morning show ewo Otaebour Media edamo asipi
yo Archbishop so meda wase se enado person so no be kan ho na afi no wodin sempa ti sei abre na yati ensem kakra ekoso e Ghana memu ene nsem kakra ekoso e wa manan abusiafo me ka che se safi na wadwani dwumedie ya Professor Shark behu pa ai behu yakopon sia se wadwani dwumedie wo be dwani na afi wa hye e de ama onamfofo abusiafo ene adofo nyina no abomodian se over double tap screen no Eddie am I said the way amount for to be who you so ye or Otaebour Media. I was here for said the Archbishop Kayano, I would in Semna Brewery. Na enano pɛ no yɛbɛtie biribi kakra de afa yɛapɔmuden ho especially mɛma no ɛno nti ne abusuafoɔ na ansa na no meka kyerɛ wo sɛ yɛnwia kofi piesie owusu a dodo no afrɛ sɛ odiifoɔ nokwasɛm ni ɔba bɛyɛ ne album launch kɛseɛ paa nyame yɛ adoma May bosome no ɛda ɛtɔ so ɛdunsia 16th ɛyɛ memenda ɛwɔ North Bronx ɛno nti no yɛn nyinaa yɛnhyɛ no so New York ɛmɛm ho asɛm ɛna mekan Very to Ricana Feno, Vincent Suma, Dr. Aquaba. Dog, Memo Aquaba, don't quit the bar or Otaebour Media Radio soon.
Thank you.
Doctor, I said, because a happy Sabbath, and I just say happy day. Auntie, I say, happy Sabbath.
Happy day.
Happy day, nice one. I just see you doing that, and AD, your home that, kaba pa. Yeah, but you have for, Doctor, many na Eugenia that. Medica can once some maybe a chairman and idea, mentioned and cacassy, son say, young Brennan tea. And I know Pewibus say a DNT and a doctor Sabaha. Or the Yapum de Jumedia, Yatu say a prostate in men. And Yama a man mapa. Na, maybe I say a dear cranny. Sir, idea no idea and a deba. A crab and if I saw you be who need no doctor Baby Church 17 doctor. Say, you can say, prostate crown, idea.
So prostate, a part of the male reproductive way system. So when you say kids will be I say walnuts. I add that blood and acid. So sometimes, say BBI okay, nobody even knows say ewo ho, but ewo ho pa juma pa. So say ebia unam na say unya problem be what way ube my area more. That could be part of the problem because juma dia on a say it helps to nourish sperms and a protected sperm means so and then also help it to move it around because it has some fluids in there. So now I say mix it with the sperm. Now it's a sperm sent to me as swimming, okay, during the reproduction period. So in here, it plays a major role. And at the same time, so I with urination and ejaculation, it helps to contract during in ejaculation. So I help it pushing the fluid into the urethra and mix it with the sperms. So I my dear pa.
Let's just say a member and it's me a year, yes, sanity.
Pacha I like in Bansu was similar thing, then had the same thing. I know a friend scans, but prostate in the AM Bema na Yamidia chop.
Wow, Meadow was a power when Chichimua, where the candy am I. And then my memories would say a hint for a pan a year risk. It was idea ubudin and I said prostate a hip hop a hint for and a year risk cassia pound.
So mostly we black men. Also. So on average, men on average, maybe a 1 out of every 8 men will be diagnosed with any problem with the prostate. So the 3 main problems that you can have with the prostate is enlarged prostate, which I know most people have heard it. Say, prostate I can see. And a benign and cause a problem. I just said because it the blood and acid, so it makes it difficult to urinate. Or sometimes but because of the enlargements. But you can also have something called prostatitis, and inflammation and infection of the prostate. Just say B akonya some type of infection. Or yes, the prostate can also get infected. And the last one, prostate cancer, which and also but because of the beer prostate, a lot of times, unya prostate cancer is difficult to see. Say BB AL. So the time you say BB will air cause the problem, no. Not sometimes now it's too late. But anka prostate cancer so it's one of the cancers that is preventable with early detection. Hence, maybe I say yenye test exams no, send a BB abnormal, but mostly black men, will be diagnosed, but 70 to 75%, more than a black man will have prostate cancer.
Doctor, I don't know. Maybe I don't know. Maybe I say, for na say, risk as because all she come see blood pressure. I'm say, for and I share a prostate to her. It's an was answer me who say, for a day and I away nip anymore. And my head, yes, sir.
So prostate, most of the risk factors, genetics. Now genetics there's not much you can do about it. Say be your papa prostate cancer, and now brother, and now uncle being prostate cancer, you are at a higher risk. So all you need to do is to get tested regularly. Uh-huh. So family history has a lot to do with it. Access to care. We delay screening. Yeah, insurance now, so yeah, doctors for checkup. So sometimes to time I bet say no, now I too late. Or sometimes to limited to the access to specialists. Ghana may need if they have urologists who can usually help people with prostate problem. So say be a ukipa scapra po why already so bad for treatment, but obi any how better no. And so it make the risk higher. Sometimes since it's kasem, we need to call back as what they call with doctors are screening. But when you're like kahuna, especially African men, we have higher risk of getting exposed to these problems. And then the death rate, we are almost like 3 to 4% higher to die from prostate cancer than ABR, with white men, because almost seek treatment early. Sometimes I have few people that have it too, but we say, hey, I'm going to surgery now. I'm going to and sadly, they rather die. So it's all come down to awareness and education for our people.
Yes, doctor, I say, Nyasem Kitwakre say, will be able more than say, Obershen who ye. Now, Cassam, what can say? Say, your fan says, some papa will be a. And I say, Selibushi will be a likely say, this is so, it's be any of a DNA, a money bassa.
So say genetics. So sometimes if it's genetic, it's in the genes. So some people have maybe a high blood pressure and now diabetes in the family. So when say somebody in the family have it is in the genes. So there are some specific genes in the body that are transferred to other family members. So it be a breast cancer. We have breast cancer. You catch us, okay, mommy with breast cancer. So you have to get tested to make sure, say, you are doing the right thing. So even if you get it now, they catch it early and they treat it. So it's the same thing. Prostate cancer is genetic way components. So if you have a family history of it, early detection, any starting screening early. So mostly I'm gonna say, people that are raised at 50 and over. So once I could do 50, a lot of things happens in the body. One of the things said the prostates, glands, it function differently. And testosterone, so it converts it into something called dihydrotestosterone. So dihydrotestosterone, it stimulates the prostate cells to grow. So sometimes a manual way, it grows too fast. So as it grows faster now, it enlarges, now I can see it. And it squeezes on the urethra, and then it makes the urine flow very slowly. So once you start seeing those symptoms, you have to get tested. And to say, oh, a family history of prostate cancer, men train till 50 before you start getting screened. 40 cry, okay, 35 cry. Start talking to your doctor. Oh, I have a family history of prostate cancer, be a papa and me uncle. So then we can start testing. I know some young guy, I think 38, and you're diagnosed, Right now, he's doing very well because right after diagnosis, no, or your surgery, or your chemotherapy to see how you're okay.
Wow, na kyerɛ sɛ ɛnyɛ asɛm ketewa koraa. Ɛno nti ne yɛmfa no sɛ menim sɛ wadi ka abɔ so de mpa mpɛ sɛ wokɔ details paa. Ɛdeɛ ɛne yɛka no sɛ early signs a wobɛtumi ahu ne ntɛm paa sɛ wei sɛ a menya yi deɛ ɛkyerɛ me sɛ meyɛ nyaadeɛ no bi. Aha.
Mhm. So with prostate, there are two primary cancer, enlarged prostate, and because sometimes BPH, and no, any cancer. Okay, most people have it, but no near cancer. And no, it's just benign with prostate hyperplasia, BPH, meaning prostate and eye cancer. It's not benign, which is any cancer. So those people, most of the symptoms that they will get is say it's like they are forcing the urine to come out. And now so and not all the urine has come out. Says still there's something there. And now jinso in tem frequent urination, especially at night. So be wakoda every 1 hour. No sorry jinso. Even though one means you pee, but oko restroom very fast. And now dribbling. Be a ordinam kakra now usre kra now say jinso ni be a drippy. And those are all there's something going on. So at that point, it may not be cancer. It could be just the prostate that are enlarged, so a blocking the bladder to do its work. But when it comes to cancer, wait, cancer one, no, I know sometimes you don't have any pain, you don't feel anything. Time I'll be say be or no, not a check. But so-called doctors no more screening, or more rectal exams ọmụ check PSA. Now, who be then they can treat it because the size of the prostate is very small. So a lot of times, you don't even feel pain when you start having way problems.
Wow. Na kyerɛ sɛ wowɔ hɔ anaasɛ dɔkta anadwo wotaa ɛdu sɛ ɔdodoɔ sɛn na wofii sɛ woda no sɛ wosɔre kɔdwo nso a ɛbɛkyerɛ wo sɛ woyɛ anya bi ame dodoɔ sɛn.
Oh, and yeah, a lot of things can cause that. So we don't want to use that as any problem because even what diabetes are, you can do frequent urination, and now sometimes in drobia or also like hydrochlorothiazide for blood pressure, and making so frequently. So we cannot use that say, oh, because making so frequently into mania prostate problems. Yeah, so you cannot say that. But once you realize that oh jinson so it's like where jinson we but I said I still jinson do. That means you didn't empty everything. So it's different for everybody.
Sɛ abusuafoɔ ɛna nɔpɛ yi sɛ afei na wode wafidie no ato a anaasɛ awie afei na wadwan ne yɛn baabi biaa a wohwɛ yɛn firi biaa no Sabbath morning show ɛna ɛtwa gu dendenden no na ɛna nɔpɛ yi deɛ yɛnyɛ yɛn dɔkta baako a ɔba bɛka yɛn nsa a wɔkyerɛkyerɛ kwan yɛfa so a especially mɛma no titiri no yɛbɛbɔ yɛn ho ban ɛde afiri prostate no ho na afei no ebi ankyew koraa dɔk ma yɛmu sa wo sɛ ɛneɛ ɛkwan bɛn anaasɛ ɛdeɛn ne yɛbɛyɛ a yɛbɛtumi ama yɛabɔ yɛn ho ban yie paa kɔ details pa ne to bo ase na afei kyerɛkyerɛ mu kakra ɛkwan yɛfa so a yɛbɛbɔ yɛn ho ban ɛne si nya bi ɛdeɛ paa ne sɛ sie yɛ paa to bo ase na afei fa de baako ne to bo ase fie kum paa.
Oh, so it's you have to go for checkups. You have to mean say mbema no yeah busy yeah juba yeah double. So yeah sometimes say yeah refi but yambo motia say at least once a year no yeah back home yeah doctors look what yeah be bibi friend PSA yeah be we rectal exam no ma check his size no to make sure say size here normal and we test no you okay. Kosa na sɛ biribi a na ɔmo ehu. Sometimes aduane di mu. Ɛsɛ pay attention to what we eat. Eating healthy, more vegetables, fruit, junk foods na ɛsɛ cutting it out. obesity. Obesity increase the risk for cancer, all kind of cancers. So, uswa, bomodia se obeye exercise. Se uhwe aduane a wodi, se uye uda rest. You have to get enough rest because stress on the body affects so many things. And to make sure you are getting enough rest. So it's stress out there. Make sure say you are finding the cause of the stress and reduce those things. Most of us is a jumano ya double sana yenda yendidi ye.
And yeah,
Ni
yeah,
nyina
demand in the dorsal, demand in the dorsal.
the man does more yes yeah well one demand from honor. They are still alive. Germany. Remember we yes after that when I woke up.
No
So
matter
we had to
enjoy. Aye.
give priority to ourselves first. And our conscience says CBB abnormal. Me say oh in to unkoye treatment oh. Minimum crop for ready best some year ready best some year no we yes in piboy yet we pray we have faith. But say oh I say okoye surgery pamucho munya surgery no even say obema nye juma biom crap ma ase. Very important radiation, sometimes very radiation therapy to kill the cancer cells, sometimes hormone therapy, chemotherapy, immunotherapy, so treatments, ɛwɔ hɔ. Especially if you're in the US now, insurance, most of your treatment will be covered with your insurance. So Ghana and so me sure says see America be Ghana. There are a lot of good treatment centers, but make sure say your treatment. Me wa down for be Ghana ne papa nye bi maybe 2 years ago. Or see heba best so heba ya no ya no di nti mpamocha wo be heba kra ni doctor nkasa ne hu say heba na wo ye no any way medical treatment we normal if not and also cause different problems somehow.
Yeah, but that's a doctor when she the more with their mind. What can say no ya na what can say PSC PSC no eh dey na be dey who say yeah yem fan say you free Ghana by be na we say Ghana we call hospitals ahodo na ade kwa ye okra na yen kan kire o eno an say ukoya doctor uka so ti yo ya no asini trust na for church o say o fe with me the eno an wi o say kwaji aduro de ko ana say kwani ngo pane nti ne enhye na ma hu terms ya kan kan nyina nti PSA ne ye de ade na ebe de no hu yiye say PSA no ene ye ye wo no.
So PSA no is prostate specific antigen. So a blood test yes a blood test that measure the level of the protein produced by the prostate glands. Because prostate glands they produce protein. So if we know the amount that is produced, it would tell us a lot of things. So it's used for screening. Wow, it's screening for prostate cancer. So the higher the number, the better indicator say prostate cancer. But if with that, once they do the test, the number no will higher. Then they will do biopsy to confirm, say, oh, I'm a cancer. Sometimes the numbers can be high and it can be non-cancerous condition, like Nyame cancer, BPH, enlarged prostate, So it doesn't necessarily mean say PSA no higher, that means you have cancer because BPH, it can also have the numbers goes up. So, but sometimes you do a draw Flomax is one of the common medicine that any prostate. You do to a draw we PSA numbers soon be down. So maybe you can say, oh, buy let's say 12. But you do to a draw kakra no ne down. Sometimes it could be infection. So we don't know. But once the numbers are high, then they will do more testing. As I said, like the way biopsy, to make sure say a cancer and a cancer. Then they will know how to treat you.
I wish for an pay and I say yes, I feel I do a feed to us here. The catcher will say, oh, Sabbath morning show. and junior subs me my happy Sabbath in a special way Mateo nka ya bomodia say obem Mateo nka ntino bomodia so be test me isan say nkomo ho abusuafo anopay ewie anwumre yeni Dr. Eugenia na atwetwe nkomo e wo Otaebour Media yi so abusuafo me fa akonye so na afi maka wo say nyame aduma wachine ye I virtual fundraising ebekoso den na anwumre 6 p.m. pepe Eastern Standard Time no virtual na idea obetimi dia Zoom line so no 898 5909 9989 na we are passcode no makacho say nida so hope I hope 0624 modia say also so no obetimi adwan dwumadi no na afi no kakra bia obenya bia no ketua bia nso awo obusuafo ketua bia nso a wonim say project no Ghana minu mie no yekrom ene yekwakoye sa project no na target is ene so no 250,000 men kan show say onko abetua sika ni nyina obetua atua kra mpacho mentua bentua ni nyina na de make catch on say o de $10 no o de $20 no o de 15 no bread so a na afi wa donate kakra na afi yekeka ni nyina si ani wi a na afi ye de kwakọ shidwumadie na doctor ni team person kokoye no ebi mu wo ha on free Ghana no so moto mu si won say project kese we say no umbefa ehu anima bebrebe na yen so de ne ye ntua kakra na afi no yemfa en support dwumadie no ana meka wo say ye ko heaven ai adum emro so adonai eno ena sof maame entwiada kwa Angelina wo say afi so no wasade foforo bi ba o adonai yame adum a bosumi epuo ni mo no ena yebeda na di ewo Woodbridge entini nyina yen hye no so say ye ka kwata of maame Angelina chi na afi dwumadi kase a wodi no etimi aboa ama bibia so akoso kama mekobi enti so bomodian say so bi hye me ho na afi nyina akwa support of maame Angelina yo doctor minim say enche kra no na afi no ye di nkomotwetwe ni nyina ekọ na wieye na memmusa wo say yekoye surgery na say yeko for treatment na ye wo effect bi ewo radiation so ana say minim say obekọ akoda machine so na afi obetra so de be kill cells na say emwa no so enu achi no yebenya effect bi ewo so ana.
Oh, so it depends. Any day it depends on the stage of the cancer, no, the treatment, how you respond to the treatment. But survival rates, it's about 90 to 95% that have those kind of problems. They can survive 5+ years. So regardless of who you are, you have a better chance of survival once they do the treatments, especially when the diagnosis early. But if time on me diagnosis, you're already at the late stage now, survival rates fall very low. I know people within 6 months, 1 year, and not move. So again, it comes down to early detection. Men train, BB how but go and check it out. Thank you.
Doctor me was pawo mu a odi amaye ebusiafo doctor na kasa no se wo ho na fe wonta nko check up a wanti mi kura no once a year there bomoden eno nkwa there me bom homoden afi bia no me try say bako na fe yemiemia me mu kakra aha na be ade ba kwa dey have fire doctor with him say o ka say obesity me menso enso da bia afi bia be ko bia me doctor say hu sa asem so they say madwene ho a betiase afi aso be ba be ko check up we be ko obeka che me say maza wo da borderline me ba be ko check up afi bia me da borderline they say madwene ho a betiase edit no me ni wa share da say be kase ni che da nya kase bia ye hu sa na
Baby, kɛseɛ no wɔ sɛ wɔ abdominal area, wɔ furu area na ɛno But say be so a muscle and then they're good. Say be our question a muscle. But muscle is heavier than fat. But say around your abdominal area, no, and then the problems be about like diabetes, high cholesterol, any friend away metabolic syndrome. So say well through area and it's not good.
Me bo me homo den pa. Abusuafo me ka say Sabbath
The
morning
way
show.
I can see,
What you say?
so the way I would say I can see near was the way through area, so I can tell say a
Oh.
honor, why.
Are you okay? Are you okay? Are you okay? Are you okay? Me person be so am amanfo hu. Are you okay pa? Dog, are you okay? Abusuafo me ka say Sabbath morning show dey twegu e na no pay yes aka Dr. Eugenia. Oye Dr. Kesie, oye Dr. Penyin. Oye nima bi te se me dwene ho aya menti ase nima oye ne dros ni nyina no. O se nya bre esa so de kogim. Ekoye exercise. Doctor, enche na afi ye di dwene de beko na wiye. Na fa ye mu lifestyle be na se yiputu on a ebitumi aboa ye any prevention fa ye mu kakra na afi no ye hu na ye fi adwumadi ni nyina enko na wiye. Se ye live lifestyle we ye be boa ya ma bi a ye nya bi na afi no ye yisi ya ebitumi aboa ye pa.
Oh, lifestyle need you just have to make time for yourself. And like within you were 24 hours and see who planning 24 hours, maybe 8 hours okay, juma. Maybe a 1 hour would be exercise, 1 hour would be share TV and spend time with the family. Can would be that. So you just have to plan your time well. Me, as you said, me my P, but when it comes to my gym, my aduane a medi anaa me sleep deɛ memfa ndi agorɔ meyɛ sure sɛ time I sɛ meda no manya me 7 8 hours of sleep nti wofrɛ me 10 na sɛ mada medu me phone no TV call off. So more mogya mo phone no notification clank 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 2 a.m. 3 a.m. clank 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 untumi nda. So for that turn your phone no off. My room no get good temperature. Turn the lights off, dim the room, and have a restful night.
Ariel ebusuafo Doctor kan sim ni nyina mo amoda ofo no odi ato vibration odi ato loud kikre oyam kra ti me show me say me phone my setting say me nya dru fia mo baby me ensa me nya dru ho no ma wa hwe me phone be ka senya adwuma me pa sorry dem pe my setting location say be dru ha say pe me phone no enko off me dru ha na ko off me nya be dru fie pe me phone no location no na kick in me gidi say ye ni sa abeboan na doctor me say kakra simba kwa me bu say otwa to un say kroma say no 8 hours no wan hwe a enso o esan say de da bia ya meta e no ka ho asem no wodi we fa ha me gi say bia da chi me no ye beka ho asem esan say me nim kwa bebre ho no a wo fa so a wodi ye adwuma semfo a say eboa wo edie mo apa 8 hours no ye ntimi na say ya na 8 hours na ye betumi ada ekwan bi so a enru 8 hours betumi aboa ya na
Oh, well, it comes with balance. So some days it makes me at 8, some days maybe at 6 hours. But no, so be back and say, oh, maybe 4 hours spend me here, and that 4 hours, and I'm fine, my okay. But as we get older now, so 4 or 5 hours, it doesn't help us. So don't cheat nature. So maybe weekdays now, put me here 5 6, it's okay. Weekends, what time now what that egum and now during the day no say free time just rest your body you don't even have to sleep but it's the up and down now then we are now we are in a race now we heart rate air course through all the time now body is always bouncing like in a fight or flight oh and then now over time and but so you can even relax in your bed so one kata we need and what relax if you will share some comedy movie be and I will read a book and I will Bible. Then I can rest me home. So 8 hours, so it doesn't always have to be falling asleep, but also just relaxing, meditating, reading something, watching something with your family. I mean, Not the save o body in society.
That was a doctor when she came out there. I wish for Doctor Kasa. Na Doctor Okasa no okay be for herbal medicine. Won say you call Ram no me no nyina ye free mo na ye ni gi abibidro ho pa. Obi o ho no a ye ta ka say oh abrofudro me ba akwa na me ta ka bi. Ne de abrofudro bibidro ne no me ye me den pa ohu me sa no edro no me ye me den. Nti da bia me bɔ mo den say menyare say me mpa ebo kese pa. So abibidro no emwa ye nipadua no na odi ka ho benim se uyi kristo ni kese pa okwa asore ye nyina ye kwa asore won se nya bibifo no asem tunye pe isese bia anke bia ye bekwa ko hu obi a oh yaw archbishop so ka me mpa bo mu na se yare bia cheme no me pese usi su biem pa na etiefo ne ahwefo nyina hu se yare chiwa se si face fat empaibo honom de nanso so ne mamodi an se be hu aduefo ana se doctor fo ana se nurses fo am hwe nti ma se musa ne se one abibidro de no na two empaibo no ka ho asem ka.
Okay, so I be no. I mean, herbal medicine, there's nothing wrong with it. But the problem is, most of them, no, we don't know what is in it. A drawback on a sign or body. So sometimes, ukofa na say bia, let's say for instance, a draw ukakofa, bibi draw ukakofa no. Yes, see a bear reduce your blood pressure. Yes, see unya prostate cancer, be fix it prostate cancer no. But ebia o doctor do what to blood pressure draw so. A baby drawer, yes, a lower blood pressure, o quack for prostate. Now already no our blood pressure drops. So what happens? It drop the blood pressure too low. And the blood pressure goes too low no, it can affect your body. Or sometimes maybe a baby will how you're allergic to, but you don't know. Na ukfedre, na bibi yewa. You don't even know what it is. But if you are not the care of a doctor, na so pese ufa bibi dro crap tell them, let them know, say, oh, may fa bibidro way, may fa vitamin way, may fa way. So now on my year way cross check. No more making sure say, okay, it's compatible with a draw, yes, so yeah, they no. And now Becca say, okay, because a draw bibidro will fee. Ebe cause problem with and see my main sister a drona media amount. So it's about communicating with our providers and letting them know everything that we are doing to our body, every medicine, even vitamins, let them know. Say me if I vitamin way, a yeah now. The same thing. I know people is see our liver, kidney problems because of bibidrobia or mofa. Before you take it, talk to your doctor to make sure say it's okay for you. And when it comes to the, how long we take it for now quantity, maybe a over maybe a teaspoon back. But because we're doing some percent a droning yen man time to mark off a cup back. Yen sir. So you have to make sure say you are following the instructions now. Yeah, the amount. No. And then the other question, what was the other question? Oh, in Pieball way, no. So in Pieball, no, yeah. I mean, when you have a problem, your first instinct is to pray to God and ask God for help or for healing. But at the same time, you also have to see your doctors. Na yenhwɛ adekora ɛha. Yɛhwɛ my Bible more. There are some people that Jesus healed them instantly. There are some people too, it took time. So healing, not dear, it can come in so many different ways. So don't make the decision on how you are going to be healed. But in Paibono yet, we have a community. You can always have the church members help you in prayer. I know sometimes in person be a better yes, and now be the say way. So I saw crying more be to say yare. Bibia boka and bibia boka want to say nyamia domo bibia yet. But meanwhile, you are hurting. If you'll be a hobby to me, wow. You never know. So who have a problem? Find people that can help you in the community. But in Paibono, yeah, Mumbo Empire, I pray every day. But at the same time, to seek medical help. ebi a ɛhɔ kwan na nyame de bɛfa so asan yareɛ. Thank you.
was the power with the Amet for any union army. You said, and I don't pay and every and then you know what kind of bush for Dr. Kata. Now, when you are seminar, and I say, I ran it to her, no fine show home. Can't a monk of 20, maybe I am a cassette. Me bear crew must say to say, Dr. Major bro, for no one, Mentiasia. The tea I Mentiasia, they say. Me bear crew must say, baby, my year, you menina. Oko hope na se broni no so yare a ohu wa no aka kire wa frɛ no aka kire wo sɛ bro me de asomasi me de obenten yare sei ɛwɔ me so enti sɛ ohu sɛ bibi sei ɛyɛ me a matade na ade bi hyem yi na yɛ ni sei wo yɛ ne saa mɛyɛ okay ana sɛ wo de manya me hwe fa me to fam bɔkɔ ne fa wo nsa yɛ me sei mɛyɛ okay Ghana ni binim say your trust issues with ya. Mama fa we example. What who Ghana ni ba na fu kese pa say what who say wonyem pa. Oh mami I say we dan is how dey can on. Also there be enya me hu na de no nemu me gare da we could dey say my kese sa no. What you say? Because be e ware no ware akatani wa hase na ada akatani no wonyin say wonyem ye menka ne sa. You also know far phone or friend my wife. I say, hey, sister, surprise. Just say you want the crop. Ada one yam. Ada be wife busa and say, na this say. Also, just 2 weeks. Just say, what you who I want here see. Now what you look or just so body the ram will be a day. I will be at it. It be a baby friend now here inside there. I didn't never see for another family say, Dr. Dia Casa. Want to share crown. So we a bema. I mean, Chemia, Coco Prince, and Anno Prince, what journey, baby, I have Bibiano. So, uncle, check up. Uncle who, Doctor, may catch you say, midnight, Doctor, I never catch you say, Coco, or what they are so much check up. Slova, so also uncle check with the made him a check him the last year, because check him in the year, you another 10 years, sir. Yes, I'll check it, just say, be clean, Doctor, be clean. Also, for you do agree, and I feel 5, you know. Yem kwa cheke na afi nhwe adidi yenye exercise yem mo dey ase be bread na afi yada the one timi ana anwumre 8 hours a wo dey da half and half wo da 4 hours kakra na unya bra no asaso ada 4 hours kakra be gidi se ebe bua ma bibia timi akoso doctor se woni asembia aka ana se archbishop se woni asembia aka na ne ye dey dwe ni bisi a archbishop wo question ana me hwe se dey oni mo se ye a wo question bu sa doctor na
It's a question and I'm a why I said beer. If you been na bema no dura or say offer serious pa say or say the course or yeah lab test ni ade no but what the ni na to say 35 to 40 ni ade nti your boy doctor abaso the doctor assist pa say na wa be kan ho na ode nkyerɛkyerɛ nti say enso amaye ya da chief nyina nso ase mo bia
wa check with the idea
Dabi afi na me
afi ene me pache wa tubrika na afi ko check na afi o hwe di die so ye kaba pa doctor beda wase pa
the doctor assist
Archbishop so kwa check ne de wa ka che na ofu nyina so say obia momodin ase wa kwa check ne de doctor asase bia ne ho a odi bejan ya
Madam was say more joining us and I'm was so bra for inviting me because I enjoy talking, sharing my knowledge and also educating our people. So Madam was for Ejumade Amudi and Munkosona Munye because it's helping many people. So as early detection is key. Uhu ntama na ye bibi wo ho. So once I can say what you don't know will not hurt you. When it comes to your health, what you don't know can hurt you later. Into impamature. Munya sure say more doctors, more take care of yourself. Okay. Yamia dom so achana me me fundraising for the We Hope Town community.
The minister cry.
That's what kind of we will build a nice community for children, vulnerable children, disadvantaged youth, seniors in Brewan Kukra. Omuni baby atma,
Yes.
Omuni Obiabebuamo, they will have a place. So yes, sit down the whole community to help others in Pacho. Yes, community no ma my Ghana.
Nice one. Ebusia for yebebo na afi yesi community no dey am I Ghana. Anope binya Archbishop e be come nsa e na afi Dr. Eugenia so e be come nsa. Na o hwe se na yebesa so de nkombo. Ye wo obrumfon kesie bi, okunu kesie bi a odin sempa e nam nyo so be breye. Na ye tu nsa fo bibia so omran. Dr. Nyame adma next month. Lesson be na de be breye.
A surprise.
A surprise of we for next month. A surprise. I don't so be able to actually never done a dear mobile home. A D. I'm just where quadruple watch it. Who free me kill be a major so. Now, no pay dear. The American answer I could push it out. So tune in. I feel Jenny, you may dear to say. And then ashing in at the Washington Ghana the church. Now, you were Bible book, a seer pa, and a day, oh, yeah, sorry, or doctor. Bompire ma ye youth na na se ye mofra no omaje atwa so be say I think say third time the fourth time ne ekoi ai che say afi bi ko bia no for America ha say nyina obetia ni say Adompa founder Chesapeake conference Washington Ghana church first place there's a democrat ye mofra no che say o be say you know afi bia first place na ene ye conference level stages ye di kan akoba akon ya qualify and ye conference level we ye operation post and win enti no ye no ye asore ye kasa ye asore dan ya nyakopo de ma ye ho ne ye Bible bowl no enti no ye ka che obia se obompa ya I Washington for so person obehwe the live so de a bra ya so dem ho isan say and bibia e da ho clean ye bompa ma mo fani nyina onyakopo nchire pa say and I will be a twin in let them kind of Otaebour Media Sabbath morning show. Nyami adma I shall send wet yanka Archbishop salute for Dr. Eugenia we check over Nyami adma we say so eshia Yago kai gina ho na omo ye ho ban ene de obra na identity na afi ya custom e wo the Washington Ghana church. Yado di for nyum no na YouTube apo and I say na the sorry the free so
je n'ai en méda chez mi Asum Dieta Wasum Diesha